So the first two tests for the shoulder are going to be anterior and posterior instability tests. So the first one is going to be anterior drawer and the second is posterior drawer, but they look very similar. So you're going to have the athlete kind of laying off to the side of the table with their arm almost hanging off. And you want to grasp the humerus, and you're going to do an anterior drawer, so you're going to pull forward. And then posterior drawer is where you're going to push backwards and look for instability. So anterior drawer, posterior drawer. So the next test is the sulcus sign, which is looking for inferior instability. So you want the athlete sitting straight up with their shoulder exposed, and you want to grasp the humerus down here, and you're going to put traction on it and pull down. And so you're going to look for that divot and a lot of laxity if they have any inferior instability. So you're going to pull down and look for a divot. So the next test is the apprehension and relocation test. So again, this is looking for anterior instability in the shoulder. So the first thing you're going to do is you're going to do abduction and external rotation until the point where they feel their shoulder coming forward. And then once they feel that point and they're apprehensive about it, you're going to put pressure onto the humeral head and relocate that humeral head back into the shoulder joint. So the next test is the O'Brien test, which is going to test for a slap tear, which is a labral tear in the shoulder. And so you want to place the athlete into 15 degrees of horizontal adduction, and you're going to apply pressure at the wrist, and you want them to push against it. And then you're going to flip over, and you're going to do the same thing with them supinated. And with the supination, it should relieve any pain that would have been with the pronation. So you pronate first, and if they have pain, supinate, do the same thing again, and it should relieve the pain for the O'Brien test in a slap tear. So the next test is NIRS, and you want to test for shoulder impingement. So you want to have them with their thumb down, and you're going to passively put them into shoulder flexion, and you're looking for pain or pinching up in the shoulder with this full shoulder flexion, and it's looking for impingement. So the next test for impingement is Hawkins-Kennedy. So you're going to have them abducted, and you want to internally rotate, and you're going to continue horizontally adducting them and continue internally rotating. And once they get into this full adduction, if they have impingement, they're going to feel it more with the adduction versus out here. So impingement, Hawkins-Kennedy. The first thing you're going to do is you're going to find the biceps tendon up into the shoulder. Once you have that, you're going to grasp their hand, and you're going to have them first pronate towards you, and I'm resisting it, and I'm feeling up into her biceps tendon, and now she's going to supinate, and I can feel her biceps tendon moving up here. So if they have any kind of weakness or if they have any pain with the supination or pronation, that would be a positive test. Second test for biceps tendonitis or biceps issues is called SPEEDS. You're going to have them start with their palm up, and you're going to again feel for that biceps tendon, and you're going to resist all the way through the range of motion as they go ahead and flex their shoulder. So go ahead and flex up as I'm resisting, and I'm feeling that biceps tendon all the way through. And if they have pain or weakness with that, it could indicate biceps tendonitis. So the last test for the biceps is going to be testing for a biceps rupture, and it's called Ludington's. So you want to have the athlete grasp their hands together and put it on top of their head, and you want to palpate the biceps, and then you're going to have them push down on their head looking for a biceps contracture. Let's go ahead and push down. I can feel that biceps contracture right there. And if they don't have a contracture with the pushing down on top of their head, it could indicate biceps tendon rupture. So So the first test for supraspinatus weakness is called the drop arm test. So you want to have the athlete bring their hand all the way up, and you're going to help them with it. And then you're going to let go, and they're going to actively, slowly lower their arm down into an adducted position. So go ahead and slowly lower. And you are looking for that controlled lowering, slow controlled lowering. If for some reason they have any kind of supraspinatus weakness, it's going to slowly lower, and eventually it's going to drop and then slowly lower again. So it's not going to be controlled all the way through. The second test for supraspinatus weakness is called the empty can test. So first you're going to have them with their thumb down, acting like they're emptying out a pop can, and you want them to be abducted to about 30 degrees. You're going to resist at the wrist, looking for any kind of pain or weakness. If they have pain or weakness, you're going to flip them over into the full can, and you're going to do the exact same thing. And if it's a true supraspinatus weakness, then they should have no pain and they should be okay with the full can, whereas with the empty can, they would have pain or weakness. So the first test for the elbow is called the valgus test, which is very similar to how it was with the knee. So you're going to hold the elbow like this with your pressure on the outside of the elbow, and you're going to put pressure on the outside, trying to open up this inside portion where the UCL is, the ulnar collateral ligament. So the Verus test is exactly opposite of the valgus test. So you're testing the LCL, the lateral collateral ligament of the elbow. So you're going to put your hand on the medial portion of the elbow, and you're going to try and open up the lateral side. So the test for medial epicondylitis is going to be resisted wrist flexion. So I'm going to stabilize her forearm, and I'm going to apply resistance to the palmar aspect of her hand and have her go ahead and flex her wrist. Flex, which is initiating all of the wrist flexor muscles that attach at the medial epicondyle. Go ahead and flex. If they have medial epicondylitis, they should have pain at the medial portion of their elbow where all of these muscles attach into. Okay. And then to test for lateral epicondylitis, you're going to do resisted wrist extension. So again, you are going to support the forearm. You're going to apply resistance to the back of the hand now and have them go ahead and do wrist extension, which is initiating all of the wrist extensors that attach at the lateral aspect of the elbow. So the next test is called the pinch grip test, and you're testing the anterior interosseous nerve, which runs between the two pronator teres muscles. So you're going to have them put their first finger and their thumb together, and you're going to basically just resist those. So I'm going to try and pull those apart. Any kind of entrapment of the nerve is going to make this weak, and I'm going to be able to pull her fingers apart. The last test is called the pronator teres test. So it's testing for pronator teres syndrome. So it's going to look a lot like the biceps test that we did, the Jurgensen's test, except for this one, you're going to be looking more for pain in the elbow versus pain in the biceps tendon. So again, you're going to grasp them, and you're going to be supporting their forearm, but you're looking for pain in the pronator teres area. So go ahead and pronate against me. I'm supplying some resistance. And then go ahead and supinate, applying resistance again. So if they have the pronator teres syndrome, they're going to have pain up where the pronator teres is between the radius and ulna. PNF stretch is the hold relax. So you're going to put them into the position where you've got resistance, And I'm going to have her push against me. So fire your hamstrings, push, push, push. Remember to hold for 6 seconds. Push, 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 push. So for hold relax, we're not going to be moving. And then relax. And then I push her farther into a stretch. Then we're going to repeat it another time. So contract, push, 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 push. So her hamstrings are contracting right now. And relax. So there's hold relax. So the next PNF stretch is contract relax. So we're going to again put her into that point of resistance. And now I'm going to have her push against me. So push, push, push. And we're going to go all the way through the range of motion, all the way down. And relax. And I'm going to put her passively back into a stretch. And now push, 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 push. All the way down through the range of motion and relax. Okay, so there's contract, relax. The last PNF stretch is slow reversal, hold, relax. So we're going to look like the contract, relax. So she's going to push against me, hamstrings all the way down, all the way down, all the way down, all the way down, relax. And now fire your quads into farther. Then we're going to repeat it again. So push, 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 all the way down. Contract your hamstrings and relax. And then fire your quads. Slow reversal, hold, relax. All right, so the first wrap we're going to do is the hip flexor wrap. So just remember on the hip flexor wrap, we're going to be pulling up and out. So the first thing we want to do is anchor it down on the leg. So I'm going to anchor on the leg here. And I'm going to go around one more time. And this time, as I go up to go around the hip, I'm going to put tension going up and out. Now I'm going to wrap around the hip. Leave it at normal tension, come around the leg again. And I'm going to come pull up and out again. And continue until we are done with the wrap. So I'm putting tension on it here. Just doing normal tension of what's left until that is the hip flexor wrap. Next wrap is the groin wrap. So remember the groin begins down and in. So again, we're going to anchor it down on the leg. So this time, I'm going to leave normal tension as I go around her waist to begin with. As I come around to go around the leg again, I'm going to put tension down and in. Continue our spica around the waist. Tension down and in. And continue the pattern until you run out of breath. So again, this is the groin, and we're pulling down and in, whereas the hip flexor, we're pulling up and out. So the last wrap we have is for the shoulder. So we want to make sure that they have their arm on their hip so that we have room to work. So the first thing you want to do is you want to make sure you're going forward to begin with. So you want to wrap up and around the arm to anchor it. So as I come around again, I'm going to put tension as I come across here, go around your body, and then come up and around the shoulder, leaving no tension. So now I want to apply full tension again around her body and continue our pattern. So here I'm applying all of our tension. Not putting any tension on the rest. So normally I would continue with some tape to hold it on there, but this is the shoulder where you're coming down and in.